Stop. I think that you really need to hear this information today. So if you are needing to go to the emergency room because you have persisting symptoms, for my case, it was chest pain, back pain, extreme fatigue, but those symptoms eventually turned out to be lung cancer, and it was ignored for about 3 months. So anyways, if you go to the ER, please make sure you are bringing any medical history or information with you. For example, if you've been in and out of the emergency rooms, make sure you have those printed out or have it on my chart, okay? And number 2, if you have some sort of symptom trackers, because they're going to ask you, what symptoms have you had? It's better that you are prepared with a symptom tracker. For example, you could even have a notebook or on your notes on your cell phone, just writing down when the symptoms began to show up or when they persisted. You know, this is considered data. I know you are probably fighting for your life or, you know, just not feeling well, but tracking your symptoms will help you advocate for yourself better in the emergency room. And then number 3, clear communication. Make sure when you are in the emergency room, know that these people working there are probably so exhausted. So as clear as possible, you could say, I'm experiencing chest pain that is an 8 out of 10, or the back pain I'm experiencing is a 7 out of 10. But please, please, please do not downplay your symptoms. I was raised in an immigrant household where I was taught to ignore pain. And in the 3 months I was in and out of the hospital, I had to learn to be honest about the pain that I was experiencing. For example, the chest pain I experienced was an 8 or 9 out of 10, okay? So make sure you are communicating clearly. Also, another thing you can do is stating your request clearly. For example, if you are having chest pain, you might say, hey, is it okay if I have an x-ray or a CT scan? Like, would that be possible? Because I'm really worried about what's going on with my chest. And yeah, I think it also helps that you look firm and you know what you were talking about versus like how I was pretty nice and submissive in the beginning of my journey, and I am no longer that way. I know exactly what to ask for if I do have to go to the emergency room. Your concerns clearly is also so important. You can ask questions like, I'm really concerned about what's going on with this symptom in my chest due to my medical history or due to me experiencing this cough or this chest pain for months now, and could you help me identify what might be causing this? If applicable, mention any family history, like somebody in your family that has cancer or has had it. That's only if it's applicable, though. I know a lot of cancer or young lung cancer patients are getting diagnosed with no family history, but if it is applicable that somebody in your family was diagnosed with cancer, I think that that would help your case as well. If you are still feeling dismissed after this whole list in the emergency room, it's okay to ask for another opinion. You don't have to leave that hospital right away. You could actually say, could I ask for another physician or someone else who is more familiar with the symptoms I'm experiencing? If that doesn't work, it's okay. You can go to another hospital. It's really helpful for you to show that you are aware of bias. You can say, I'm aware that these symptoms can be overlooked with young patients like me, but I just want to make sure that we are not missing anything. And those are some tips I wish I had known when I was 28. I was ignored in the emergency room for about 3 months, but I have friends who were ignored for more than a year, and then they were diagnosed with stage 4 lung cancer. I was diagnosed at stage 3 and considered kind of lucky, but I want it to be different for you, and I want it to be different for the future. And the only way we can do this is if we become better patient advocates ourselves.